Today, we have 5 billion people who already have access to medicine. We can celebrate that fact that 5 billion people among us have access to essential medicines and vaccines around the world, and that has led to many lives being saved. We have a challenge of 2 billion people that still need to be reached. And if you look carefully at where the 2 billion people are mostly affected, they live in low and middle income countries. 83% of the world's population live in low middle income countries. And so what's the challenge? The challenge is we need to reach these people. We know of the state of access to medicine through personal experience as patients, as family members. We also know it by looking at the news. The news, of course, is somewhat skewed in certain circumstances. But today's world, we are faced with serious shortages of even life-saving antibiotics, something that we take for granted. Today's world is improving science and making sure that science reaches more people. In today's world, diseases that can be eradicated completely, like measles, are making a comeback. So we need to be aware that the access to medicine discussion is a problem of today, and it affects all of us. When you think of how science reaches people, when you think of the newest innovations that are brought to the market, how many of them actually reach people? Here I show you data of products that have been brought to the market. And when you look at 5 years after they've been launched in the market, products like new breast cancer treatments, novel anticoagulants that are used for cardiovascular diseases. Globally, they reach less than 10% of the world's population. And that includes developed markets. So less than 10% of you will have access to these treatments. In emerging markets, as you can imagine, it is much less. Less than 1% of the people in the world have access to new treatments within 5 years of launch. So what's the problem here? We have science. We know science works, as many people have spoken about today, but we're unable to make sure that our scientific discoveries are able to reach the people who need it the most. Innovation in healthcare products. What do we need to do to solve this problem? We need to innovate in making sure that there are new health products. As Camilla mentioned earlier, there's thousands of diseases where there is still today no treatment, no cure, not even a preventative measure in the first place. We need to make sure that products are made accessible to people living in various different climates, temperature sensitivity, in warmer climates, in colder climates, in countries where you have different climate changes. We need to make sure that products are appropriate. How many times do you think to yourself when you're bringing your child for a vaccination that you can only take that many injections into your child? We need to make sure that we have injections that are able to vaccinate against multiple diseases in one prick. And we make sure that products that are this big should not be tried to given to a child that cannot swallow something that is so big. We need to ensure that adherence to treatment is also improved. One of the reasons why antibiotic resistance is there in the world today is because people do not finish the course of treatment, because it takes 7 days to finish a course of treatment. And after 3 days, you feel better, so you think to yourself, I don't need to continue. So I save it for a friend, a family member, or I actually feed it to my plants to make sure my plants grow better. Innovation in making sure that courses of treatment are made shorter improves adherence to treatment, improves lives. We also need to innovate on price. How many times have we suffered from this problem where price is an issue for access? We're facing that in all markets, developed or developing. And when you think of how people live around the world, there are many tiers, as Anna has explained earlier. There's level 1, 2, 3, and 4, and the bulk of the world's population are living in the middle spectrum of it. So we need to innovate on price to make sure that every single person in different socioeconomic status can get access to treatment. And we need to innovate on ensuring supply. Not only is it good enough that you bring your science to the market, not only is it good enough that you reach, well, hopefully more people than what I've shown you here today, but you also need to make sure that they have access to the treatment forever. You still have empty shelves all over the world. Are we innovating enough on this? In Nicaragua, vaccines are brought to people. In Nicaragua has got a lot of rivers, so you need to bring vaccines to people using horses. So these are vaccine vials that are transported to people all over the world. Today, in the mountainous region of Rwanda, we're using drones to transport essential medicines and blood products across for different people. So we are able to innovate in access. I think this is not unfamiliar to you, that the advent of mobile technology has really improved over the years with many more subscribers to more mobile technology, and everyone has a cell phone nowadays. Mobile cellular subscriptions are going to be skyrocketing. Now, is the mobile phone that you're holding in your hands today, that you can imagine someone living in an emerging economy is holding in their hands today, is that going to be a constant reminder of how the world lives on the other side of the planet? How privileged people are on the other side of the planet? Or is it going to be something that helps you access treatment? Today, I'm happy to say that many apps are being used for payment of healthcare. They're being used to remind mothers for when their children need to come for treatment and need to come for vaccinations also. And they're being used for pharmacists to app each other to say, look, my stocks are low. Send new supplies of medicine and vaccines over to my stocks. So that's how we need to innovate. And we need to innovate faster because there's going to be 600 million people who are going to be accessing cellular phones in sub-Saharan Africa alone. What does my team do about this? In order for science to reach more people, you need to stimulate the scientists. Scientists are among us, in academia, in biotech companies. They're also in the pharmaceutical industry, where they are the core innovators and producers of life-saving medicines and vaccines. Here I show you what the work of my organization is in doing. We evaluate the largest 20 research-based pharmaceutical companies and what they are doing to ensure that their products are reaching people. Do they have a strong research and development pipeline that is intended to solve the problems of the world's needs in unmet medical need? Do they have a strong strategy to set their prices to ensure affordability to multiple spectrum? Do they do this in a responsible way? Do they have intellectual property management systems that block access or actually help to support access in competitive ways? This is a constant competition among very competitive companies in this world today, because we do need to look at how these companies improve access and challenge themselves constantly in reaching more than the 10%, reaching more than that 1%. And I hope that 5 years from now, when I'm presenting here, I'll actually have numbers to show that that change has actually come. When you have data to show what good practice looks like, you need to make sure that it informs policy. It informs innovators. It informs editors to ensure that data is brought to a wider audience and is used to make change. Here I show pictures of how our data and data that we have with other partners that work with us are brought into discussions in the parliamentary hearing in the UK to change policy so that people are aware of what development policy, foreign policy, health policy, and how that has an impact on access to healthcare. Training and teaching, not only to young students, but also to members of staff so that they don't become complacent on knowing we've already achieved everything by bringing a product to the market. That's the beginning of a long race in this regard. In this image on the bottom right side, you will see an image of Suzanne, a member of my team, on daytime television explaining to people about what's the power of vaccinations, what is the power of the vaccine industry, and how it is the responsibility of individuals to also make sure that they take vaccines. We also need to unleash the power of investors. Here I show you over 90 investors that believe in the principle of the Access to Medicine Foundation, which means they've committed to believe that long-term investments in healthcare is important. They believe that these emerging economies are also growth markets, and they will invest in sustainable and responsible practices. You see organizations now that were not there before and many years ago. So UBS, one of the largest banks in the world, BNP Paribas. You see pension funds that are slowly understanding like this is really, really an important area to work in. And by unleashing the investments all the way in the beginning of the value chain of healthcare, we can change access to medicine. Now, all of us have it in us. All of us have the ambition to improve access to healthcare. We all want to have healthy lives. We want to explain to our children, our nephews and nieces that life is fair, and the privileges that you have here are the same that the privileges that a child has in another part of the world. The problem is complacency. The problem is that we celebrate prematurely when we haven't finished a goal. Usain Bolt doesn't stop halfway in a match, in a sprint, and say, "Okay, I'm really fast enough at this stage." What we need to do is we need to acknowledge the fact that we have already found ways to reach 5 billion people in the world, and all we need to do is reach 2 billion more. Thank you.